Coalition MPs enjoyed that, particularly the Conservatives, seated just behind George Osborne.
We've seen people cheering the deepest cuts to public spending in living memory. In living memory.
We made sure we're all in this together.
The deepest cuts in living memory.
We were expecting to be able to film inside a primary care trust meeting we've just been to ask the primary care trust what their plans are around the Leyton Green clinic, which we understand is threatened with closure. We weren't allowed to film in the meeting, hence filming outside. There's big issues developing in the area, in particular around the clinic, which is a very well-used clinic. It's been there since 1932. It predates the National Health Service and is used by young mothers for diabetic care for the elderly and chiropody and various other services run out of it. There's been a huge groundswell of support in the local community to defend the clinic, including a local demonstration a number of weeks ago, which involved service users and trade unions and local campaigns.
Myself, I got involved just because I saw a leaflet in a shop. I use the clinic. I have good experience. I've been well treated when I was pregnant there and then when my daughter was born.
The way the meeting was set up was very much not designed to enable service users and the public to be able to question the PCT thoroughly and have an accountability from the PCT about the decisions that they are due to make over the coming months about closures, not just of the Leyton Green clinic, but of other services that people rely on in the area. The response we get from people on the streets and out campaigning is very much that people need more services, not less services.
They don't give time for us to explain more or to ask more questions or to develop the issue. And yeah, it feels like there is not much hope to trust them or to work together with them. They say that they want to listen to the public, but I really find shocking that they say that they are considering all the options, and then when they have considered all the options, they will consult to the public. I think, but it makes sense to me that first they consult the public, they know everything. What do they think? What are the expectations? What are the needs and the wants of the people in the borough? And then consider, not the other way around.
I also thought in the meeting that there was a level of dishonesty, really, in that we were told that no decision has been made yet, that it's all up for discussion, that there are numerous options, but they weren't clear about what those options were. And in addition to that, there is rumour of staff being moved out of the centre or certain services being moved out of the centre already, which makes it very difficult for us in the campaign to actually believe when we're told that that no decision has yet been made.
District nurses are the nurses which goes to the houses to look after the ill people that probably they cannot go to the clinic or hospital. I've been told they have been already removed from the clinic. So if they say no actions has been taken so far or no decisions, but it seems some decision has been taken.
The mention of redundancies in the meeting seemed to be raised in a very kind of glib way with no reference really that when you talk of redundancies you are talking about ordinary local people's lives.
I've got like sheets with a petition to ask people to sign in support of the clinic to keep it open. So first I was going to the library or the baby clinics or places, public places. But then at some point I decided to knock doors. So I started on the street where I live and then the streets around the area where I live. And many people are really positive and supportive, and many people say, look, good luck with the campaign, with this project, I mean, yeah, to the campaign to try to save it.